Actually, I have a question about steaks. We're gonna get to that because steaks have a lot of blood in them, and we're gonna talk about blood. And blood is a quite it's a wonderful thing unless it has cancer, and unless it has problems. And we're going to talk actually about helping those that have problems with their blood. And it's an exciting advances, in fact, in blood cancer medicine offer hope and empowerment to patients. And we do have a patient with us, which I always say, thank you very much. That's really a kindness and a giving back under your own personal scenario. And your name is Astrid, right?
Yes, thank you for having me.
Thank you, Astrid. And we do have a doctor from Omaha, Matthew Luning, DOFACP, is an associate professor in the Division of Hematology Oncology at the University of Nebraska. Okay. So why don't you start, doctor? Tell us what we're talking about here.
Certainly. So thank you for having us. I'm a blood cancer doctor. I specialize in lymphoma, and I do clinical trials. And one of the clinical trials I was involved in was a CAR T-cell trial with Breyanzi. And both Astrid and I are here today compensated for our time by Bristol Myers Squibb. So when we think about lymphoma, as you alluded to, lymphocytes traffic around our bloodstream. But they like to find their home in what are called lymph nodes. And so when those lymphocytes go awry or go crazy or just go out of control and become cancer, often it can become what's called a lymphoma. And so those lymph nodes, which are normal structures, in our body, get enlarged, and these lymphocytes are now kind of reproducing too quickly. Now, there's over 60 different kinds of lymphoma. The most common type is diffuse large B-cell lymphoma, and that's an aggressive lymphoma. Most patients will have symptoms. They may show up in your ER. They may be diagnosed in the hospital, but some patients can be asymptomatic, where all they feel is, lymph nodes that weren't there, a month ago, and now they are, and they're diagnosed, a couple of weeks later. The median age is about 66 years of age, and there is no significant predilection for one gender over the other. But when I talk about 66 as a median, we're going to hear from Astrid, and so it can be a spectrum of the age that you're diagnosed with diffuse large B-cell lymphoma.
One last question, then we'll go to Astrid, our brave patient coming here and speaking. Do we know how this happens? Why this happens in the blood?
The immune system is one of the most nimble parts of our body, meaning that, it has to respond to viruses, bacteria, things that are trying to hurt us. And so based upon kind of that nimbleness, sometimes it makes mistakes. And those mistakes can lead to typically not one hit, it's multiple hits. But those lymphocytes just get disorganized, and the disorganization leads them to multiplying over and over and over again. So it isn't like I can tell you that there's one thing that led to cancer, and often there isn't always one thing that leads to cancers in general, but also here when we're talking about our aggressive lymphomas.
Okay, Astrid. So how did you know
Mhm.
you had this concern? And thank you once again very much.
Yeah, of course, thank you for having me. So, like you said, I was diagnosed when I was 29. I was in my master's program, recently married, trying to become a physician assistant. And I started having this itching all over my body for really no reason for a while. After that, my symptoms started to become worse, where I was very fatigued with exercise. I had a lot of flu-like symptoms on and off, night sweats, where I would wake up drenched, in sweat in the morning. And then finally, I had this really severe chest pain that ended up going to the emergency room, and a scan later and several things later, I found out that I had large B-cell lymphoma. It was very shocking news to hear that word cancer. But after that, everything happened very quickly. I did aggressive chemotherapy for about 6 cycles and endured the side effects of that. And then after I thought I was done with the 6 cycles, Unfortunately, my cancer came back very quickly after that. And that was very devastating news for me and my family. I was very afraid of what was coming next. And my doctor offered me two choices. It was either get a stem cell transplant, so more chemotherapy, or do a CAR T cell therapy through a clinical trial. And I ended up doing that CAR T cell therapy.
Wow. Okay. So, doctor, I was fooling around, but not fooling around, with the steaks near in Omaha, and a lot of. But when we eat foods that are, is there any assets by eating foods that have blood in them that can help our own personal blood be healthier or not healthier?
So one of the things that blood does have in it is iron, and I think that when you think about blood conditions, if you are losing iron or you're low in iron, you can sometimes utilize the iron from meat in that situation if it's necessary in the body to replenish the iron stores. But short of that, and protein in general, as a source of protein as part of your diet. I'm not aware of any other significant benefits to eating,
it's one of those
drinking blood.
wonderments. So Bristol Myers Squibb, one of the greatest companies in the world, pharmaceutical, a lot of research, and have saved a lot of people's lives. What is some of the medicine that they have? What does that do?
Yeah, so when we think about lymphoma and where the footprint has been is in regards to CAR T cells for the treatment of diffuse large B-cell lymphoma, the diagnosis that Astrid had. And as you heard in Astrid's story, she was treated with very intensive chemotherapy up front with the intent to cure her disease, meaning that to take it away and never have it come back after only one therapy. Unfortunately, about 40% of patients with large B-cell lymphoma either have their lymphoma come back or it's not gone at the end of that first-line therapy. And for 30 years, you heard Astrid was given the option of doing an autologous stem cell transplant, which even before you get to the transplant, you have to do more intensive chemotherapy. And again, for 30 years, that had been our standard of care. And so with CAR T cell, which is actually where we took Astrid's T cells out, sent them away, re-engineered them to become better fighters against her lymphoma, and then were put back into her body to go circulate around and try to hunt, for those lymphoma cells. And so in a head-to-head trial called the Transform trial, Breyanzi went up against that 30-year standard of care of chemo plus transplant. And in that trial, 75% of patients who received Breyanzi or the CAR T cell achieved a complete remission. And when we achieve complete remission, that's where we're starting to see the durability. And that durability was shown in the Transform trial, meeting its primary endpoint of being statistically significant over that 30-year standard of a transplant. But CAR T cell is not a walk in Central Park. There are, toxicities with it, including cytokine release syndrome, neurotoxicity, and the potential for secondary cancers. So it's incredibly important if you get a CAR T cell that you continue to follow with your healthcare provider.
Astrid, you're fantastic.
Mm-hmm.
So, and that is fantastic.
Thank you.
And just thinking about what they're doing, and that's magnificent science moving
Mm-hmm.
forwards. So, Astrid, as you live to 365 or longer, because of the brilliance of science and the brilliance of these pharma companies that spend a lot of time with pharmaceutical research and wonderful patients, right? Like you're coming out, those people that take those testing, I mean, they need to be honored as well. What do you suggest for anybody that
Thank you.
in the condition that you have been in during this time? What do you say?
Yeah, yeah, and thank you for asking that. Cancer is already a very isolating disease to have. It's easy to kind of just remove yourself from everybody. And so one thing that really helped me throughout my journey was to have the support of my friends and family and really try to open up to them about what I was feeling, what I was going through. And for those, I would ask to try to, keep your family close to you. If you don't have family or friends close to you, there's always support groups. like at the local hospital, or even social media has groups with cancer patients that are willing to be an ear to you. I would also, one of the things I did was I advocated for myself. I asked questions to my oncologist. I made sure I trusted him and I felt confident moving forward with this treatment, because CAR T cell therapy wasn't easy. Those first 30 days were very hard. I had a lot of fatigue, a lot of weakness. And really, that's one thing that I want to tell patients, is that if you're going through this, you don't want to lose hope through this. You want to kind of trust in your provider to give you the best treatment possible.
The power of positive thinking. Doctor, do we have a website or we can find out a little more information about this?
Yeah, one of the websites that you can go to is breyanzi.com. So saying it, it may not be like spelling it, so I'm going to spell it for you.
I was going to ask that.
BREYANZI.com.
All right, great, fantastic. Thank you both very much for sharing this important information. All the best. Thank you.
Thank you.
Thank you for having us. We appreciate you.
Bye, and vice versa. All right, see you later.
Bye-bye.
Bye-bye.